Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. I have some rather difficult news to share with you today. Throughout the last week, our cases have continued to climb to levels not seen in over 6 months. Modeling released by the province and by our own local modelers at York Region Public Health has made it very clear that urgent action needs to be taken now in order to avoid a very significant increase in cases, leading to hospitalizations, potentially to deaths, and a severe strain on our healthcare system. We had all hoped that the worst was behind us, but unfortunately we are now facing a very difficult period. In Ontario, we have seen an increase in almost 25% over the last week, and around 5% of tested samples are now positive. Omicron cases now represent a majority of cases in the province and are poised to rapidly overtake Delta as the dominant strain. Across the province, we're seeing very significant transmission despite widespread vaccination. While many of these individuals have symptoms, thankfully, being fully vaccinated is preventing them from needing admission to the hospital. Vaccination is still protecting us from severe illness. However, with this increase in transmission, we are worried about unvaccinated or immunocompromised people becoming very ill and needing acute care. We are also very concerned about waning immunity in those who are over age 50, and particularly those who are over age 70, who are at higher risk of severe disease. Third dose vaccinations have been available for 70 plus for several weeks, and this Monday they are beginning for those age 50 plus. At this time, it's critically important for anyone in these age categories to get vaccinated as soon as possible. While the provincial and York Region Public Health's plan had been to gradually vaccinate all individuals in this age group over the next weeks to months, the current situation with Omicron means that we'll be rapidly developing plans to immunize as many individuals as possible over the next 2 weeks. If your second dose was 6 months ago or more, you are now eligible. If you've already booked an appointment at a clinic or a pharmacy, that's excellent. If not, please do book an appointment at a pharmacy or at our York Region clinics at york.ca/COVID-19 vaccine, or by calling Access York at 1-877-464-9675. If a convenient appointment is not available, we are working hard with our partners in primary care and the healthcare sector to open new venues for immunization as quickly as we can. Getting children who are 5 to 11 years old vaccinated is critically important to their health and well-being and for them to be able to stay in in-person school. Our modeling has also suggested that getting children vaccinated as early as possible will contribute to limiting overall community transmission in this coming wave. We're glad to report that over 25% of 5 to 11s in the York Region have received their first dose. We are aiming for 50% by the beginning of winter break, and almost all students by January 3rd plan return to school. In order for them to be somewhat protected with that first dose by school return, children will need to be vaccinated by December 19th, 2 weeks before their return. Fortunately, we have a full week of clinic appointments available only for 5 to 11 children, and we're excited to announce our Barry Beachy Super Clinic for kids at St. Jean de Brébeuf High School in Vaughan for this coming weekend, December 18th and 19th. It will feature a kid-friendly environment of sun and beach fun, special guests, and attractions. Kids can even bring their 50-plus grandparents to get their booster doses as well. You can visit york.ca/COVID-19 vaccine to book an appointment at that super clinic, at any of our other clinics or pop-ups. Earlier vaccination means earlier protection. As the holidays are approaching, one of the most important things that people can do is make sure that everyone you're gathering with is vaccinated. However, unfortunately, we have already seen significant transmission in holiday gatherings, even among the vaccinated, so this alone is not enough. It is critically important that we keep gatherings small, ideally under 10 people. Stay at home and do not gather if you are ill or have come in contact with anyone who may have had COVID. Keep on your masks and make sure to distance. You may also want to consider planning to work from home if you're able. We'll be providing further guidance on public health measures later this week. Furthermore, rapid tests will be available shortly for added protection, and further instructions about how these will be used in Ontario and in York Region should be forthcoming. This is a very challenging period in York Region, in Ontario, and globally. It is also so difficult to quickly adjust to this new realization that our optimism of the last month was premature and the current reality is very different. We are working very hard at York Region Public Health to prevent the surge in cases and the health system strain that has overwhelmed so many areas of the world. We need your help, and with your help, we can ensure that York Region residents are able to meet this challenge as we have met many before together. Visit york.ca/COVID-19 vaccine for the COVID-19 vaccine clinic locations and hours. Please stay safe and stay informed.